Hello and congratulations on the birth of your baby. Before you leave home, I like to take a few minutes to discuss with you the topic of postpartum hemorrhage or excessive bleeding after delivery. The aim of this is to make you understand what is normal as you recover, what are the warning signs, and when to seek medical care. If you have questions that come up during the conversation, please tell me. It is normal to get vaginal bleeding lochia after delivery. This bleeding is typically like a heavy period for the first few days and then gets lighter over the course of a couple weeks. This is different from postpartum hemorrhage though, because the bleeding is far more excessive than normal and can quickly become a medical emergency if not treated promptly. Poor uterine contraction after the baby and placenta have been delivered is most common cause of postpartum hemorrhage. Other causes are tear to the birth canal, placenta remnant in the uterus, and problems with blood clotting. Certain women are at greater risk of postpartum hemorrhage. These risks include multiple births, prolonged labor, giving birth to a large baby, cesarean delivery, multiple pregnancies, or postpartum hemorrhage following a previous delivery. Even when these risk factors are not present, it is crucial to recognize the signs and symptoms of postpartum hemorrhage as it can occur with any woman after giving birth. At home, check the amount of blood each time you change your sanitary pad. If you have more than one sanitary pad soaked throughout an hour, particularly if this occurs more than 1 hour after the bleeding has begun, past blood clots the size of a golf ball, or notice the bleeding suddenly increase after it has begun to slow down, you should seek immediate help from a healthcare provider or go to the nearest emergency department. If you experience dizziness, faint, weakness, rapid heart rate, or shortness of breath, or cold or clammy skin, you should also seek emergency medical care. These symptoms could indicate excessive bleeding and emergency care is needed. Without prompt treatment, postpartum hemorrhage may cause a woman to lose so much blood that her vital organs suffer damage. She becomes anemic, suffers from shock, or even dies. Prompt diagnosis and treatment add to a good chance of recovery and avoidance of complication. So, get plenty of rest, drink enough fluids, eat foods that are rich in iron, including lean meats, beans, spinach, and fortified cereal, and take any medication or iron supplements as ordered by your healthcare provider. Follow up appointments with your healthcare provider must be kept, and your recovery must be monitored. Avoid using tampons until your provider says it's safe to use them in order to lower the risk of infection, as well as being able to keep a safe track of your bleeding. I want to make sure I'm clear before we can go. Can you explain to me in your own words what signs of bleeding would make you call your healthcare provider or go to the emergency room? What symptoms would tell you that you need emergency medical care? What are two things you can do at home to help with your recovery? Great. Thank you for bringing that up to me. You grasped the information very you grasped the information quite well. Remember, if you experience heavy bleeding, pass large blood clots, feel dizzy or faint, or think something does not feel right, seek emergency medical care immediately. If you have any questions or concerns, don't hesitate to reach out to your healthcare provider. Taking care of yourself is an important part of caring for your new baby. Again, congratulations, and I hope you recover safely and healthily. Thank you.